Hey guys, I've been trying to get you a video up for the Dear RV Butterfly channel, but we've been so busy, and we're busy again this morning. We're on our way to my doctor's appointment, and Bert apparently is going to have some more appointments, so that's I don't know what it is about doctors and CT scans and MRI scans, and you know, he just got a CT. Now they want him to have a CT again. However, she didn't answer my questions yesterday that I had written her about his sinus bradycardia and his intraventricular conduction delays. So he has that, and it's moderate, and from what I understand, that is how you get a pacemaker, end up with a pacemaker or a stent or whatever. And that wasn't even mentioned. So I wrote her an email back to tell her he just got done having a CT scan on his brain.
Right.
So, I mean, I know how my mom felt now. I really do, because you know, she was so tired of getting tests by the time she was 80. She was like, forget this crap. And I know you have to do that. But, as lay people, I guess you would say, a lot of us don't know what is necessary or why we would get 2 CTs for the same thing, or, you know. And I just feel like this doctor doesn't really explain those things to us. You know, it's more like, okay, this is what you're going to do, this is where you're going to go, blah, 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 blah. I got a PPO on purpose instead of an HMO with Humana. And that's my insurance for Medicare, I guess you call it. But, sorry guys. But, I was under the impression you didn't need a referral if you had the PPO. But ever since I moved to Texas, everybody wants a referral. And they're saying that, you have to have a referral because that's their office, requirements. So why pay double for a PPO if I'm going to have to wait for a referral anyways? I mean, I just don't get that. You know what I'm saying? There's something, you know, I never get political on my channels because I never want to, you know, but Trump is our president, and he needs to know what real people go through as far as getting care from these doctors when you're on Medicare, and things that they do to, you know, is this in their contract? In other words, that they have to give us a referral for everything. And I mean, there's really no reason to have a PPO and an HMO except for you should be able to go to your to a doctor of your choice if you have a PPO. Well, if that's true, then I should be able to get a cardiologist to look at Bert instead of a internal medicine lady. And she was talking about sending him to a pulmonologist. Okay, yeah, we've seen one of those before. Both of us have. It had nothing to do with. It was to do with our COPD, you know. And they told us that, of course, both of us needed a CPAP. Well, I could never keep that sucker on my face, so, you know, that I was diagnosed before him with sleep apnea. I don't know what to say about that. I really don't, because there's people who can wear it. I got absolutely no sleep when I tried to wear it. And the last time...
Turn right onto US 69 South, South Pacific Street.
Sorry, guys. That's Lola talking. Anyway, get my track back here in my brain. Alright, so we went to the pulmonologist. I was first to get prescribed a CPAP. I had one of them stupid Philips recall CPAPs. But thank God I didn't use it enough. Because they've been recalled. And you know, you guys probably heard that old story. I don't know. Something was going. I don't know. How do you... I ain't even going to touch on that. Because I'll go crazy on the Philips CPAPs. So, but anywho, so we were seeing a pulmonologist for that. And then Bert, of course, they said they thought he had sleep apnea. He wouldn't even go get the test to spend the night in the hospital because he's like, they're not putting that shit on my face. I even made a video.
Turn right onto US 69 South, South Pacific Street.
I even did a video on when I was in the hospital, a funny video. When they sent me overnight to go get my CPAP test, or my sleep apnea test, and I took a picture of me with, look guys, let's see, I gotta show you something. We're driving by this. Sorry.
Continue for 26 miles.
Anywho, I have a video. If you go look at my RV Butterfly channel, it's RV Butterfly of reselling and thrifting. And, yeah, I think it was about 2 years ago. So you got to scroll down into my playlist to watch it. But, yeah. So anyway, I told them the last time, which is not this doctor, but I think I told her too. If y'all want me to have a CPAP, you think I need it, whatever, then I need the one that's automatic. You put in your little, they put it in under your skin, you know, and you don't have to wear that on your face. I can't do that, and one reason I can't do it is because I had an ex-husband who used to put his hand over my face when I used to snore, and he would hold it there until I couldn't breathe. And so he did that so much until I left that I just couldn't. I tried to wear the CPAP. I really, really did, and I just could not do it. And I said, no, I'm not doing it. It made me have anxiety and everything else. So if indeed I need to have my sleep apnea addressed, they need to get me one of those ones inside my shoulder. I won't care, but I'll try that. No more CPAP machines. But anyway, so we had seen a pulmonologist in Georgia for about a year, and he basically took care of our COPD. So I'm not sure why. And I asked her that. I sent her an email back and said, okay, you're saying he needs a CT scan now, and you're going to set him up for one. He's just had one, you know, so what is this one for? And also, why are you referring him to a pulmonologist? I mean, I got it. Pulmonology has to do with cardiology. Yeah, I got that. But since I know that they're saying EKGs sometimes come back wrong, and they did that to me 5 times. Mine came back bad, and I had to have 5 different, what do you call it? Angiograms? Yeah. And after my last one, I found out that the hospital that did mine was the hospital that was doing it just to do it, to make money or something like that. So I'm like, this is crazy. I mean, it exposes you to radiation, you know? All these things do. It's like, you know, when I went to the hospital in Georgia, I went to ER a couple of times because I had a pain in my side, in my left side, and I thought it was kidney infection, you know, whatever. Okay, they didn't tell me anything, but they kept giving me MRIs over and over again. Like, I'm talking every couple of months. Finally, I just said, hey, look, I don't like taking these MRIs every couple of months. I mean, is that safe? And they got pissed at me for asking that. They were like, well, that's all we know to do. Hence, I never went there again, okay? But I didn't find out I had whatever that crap is, irritable bowel syndrome or some crap, till I moved here. And then they diagnosed me. But again, I had to take an MRI, you know? I mean, everybody wants to know, why are we spending so much on healthcare? Why is Trump pulling back on all this shit? That's why. See, doctors are signing these contracts saying they'll accept a little, like a discount on their patients' bills if they take that contract to see those patients who are Medicare, Medicaid, whatever. And so, this is my opinion now, guys. I just think we're all, not all of us, but a lot of us get secondary care because we do have Medicare and we do have Medicaid, and, you know, they're only going to do what they have to do. And then they find other ways to get other money. Because if you think about it, I'm going to my pain appointment today, right? Okay. Well, my primary care cut me off something I was on for 20 years, which was pain pills, but I took one when I needed it. I mean, I would never be a drug addict. I'd make the most dumb drug addict there is because I hate taking them. But anyway, so they had me on those for 20 years. It was for a back injury I had, and I had that horse accident where my leg is filled up with hardware and stuff like that, so it wasn't fun. But anyway, so she took me off when I got here. She said she couldn't give me my anxiety medicine and my pain medicine, that I needed to go see the pain specialist. So to think about that. So I said, okay, I'll think about it. Because every time I went to a pain doctor, they wanted to give me those shots, and they didn't work for me. But anyway, but I went ahead, and I did, because I started getting pain again a few months later, because I hadn't been taking anything when I get it. So, but my point about that is, the pain doctor charges a copay of $45. I have to go there every month if I want to get these pain pills, right? And I understand why and all this stuff, or at least their excuse why, because people abuse them, and so whatever. So they're getting $45 per patient every time a patient walks in the door, at least, for their copay. And private patients are probably paying more than that. If they're not, their insurance is. And our insurance, our Medicare insurance, is paying for that visit every single month. And $45 is our copay. So what's my guess? $450 is what they bill every month when you go, just to make sure you're clean. You know, I mean, that's just, if he wants to actually do something for the people, for the health stuff, he needs to put this health stuff in perspective. And he needs to be out in the neighborhoods and see what's going on, talk to the people, how much they have to pay, especially the elderly. You know, the elderly, like Bert and I, we don't, what do you call it? We do not qualify for government assistance of any kind, okay? And that makes you think, wow, these people have money. No, hell no, we don't. It's just that if you ain't starving hand to mouth for at least 2 weeks out of the month, then you don't deserve it. So, I don't know how other people do it. But, my point is, somehow or other, he's the President of the United States, whoever it is going to have to regulate healthcare so that it is available and it is even for all income levels. Because, especially for elderly, I mean, we have no choice. We worked, most of us worked all our lives, and then we get our Social Security. we get our Medicare, but even though we pay into Medicare when we're working, because I did for the last I don't know how many years, we still have to pay for Medicare out of our check every month, unless you are under the poverty level, and so then you can get Medicaid. But then they're ripping them off too. I mean, I know everything is expensive, and nowadays my feeling is that there's so many people not becoming doctors anymore because of all the malpractice and all the mistakes doctors made and all, and all that crap, that now they're charging double for their services because they know they can, and they can get away with it because, let's face it, there ain't that many doctors out there for the patients anymore. Yeah, this is a lot to take on a morning run, huh? But you think about it. You think about how some people, they go there like automatic and they pay their money, not just to the pain clinic, to all the doctors. That's like people think that people on Medicare get shit free at the doctor. No, we don't. We have to pay a copay every time we see the doctor. Most of the time we have to pay a copay for every piece of medicine we get. And any specialist we go to is a higher copay. So if you get a test, you're paying 20% at least of what that test is being billed to Medicare for. So I don't know how people survive, because with all the tests they're going to run on Bert and me, there's going to be no way we can do that. Not and live. Unless we're living in our car. I'm serious. With the rents the way they are, with the food the way it is, hopefully that'll start coming down. But when you're older, you have more medical problems. And I know so many people who are in my family that they got elderly and their husband had heart attacks or whatever. So the women needed medicines, and they were prescribed medicines, but they didn't get their medicines because they only had enough money to get that husband's medicine, and they did it for him. So that should not be happening in the United States. I'm sorry. I am very sorry. That should not be happening, especially to our elderly. You should not have to make a choice between whether you put a piece of toast on your table in the morning or a pill that you can't afford. So I don't know how he's going to profess to do that, but until he really, really sits down with somebody normal like me, well, I don't know if I'm normal, but and says, okay, tell me about the way this works with these programs. Because everybody thinks it's so easy. You just go get on these programs, they give it to everybody and blah, blah, blah. No, they don't. No, they don't. It's very hard to get it, and it's a pain in the butt. If you don't drive and you don't have a relative that drives, you ain't getting to the office where you have to do all this crap. But anyway, we're at 18 minutes now. I don't want to bore you guys to death, but I want to know how many people feel the same way I do, because I'm thankful for whatever I get to go see the doctor, because I know that there's people that don't have any funds or anything to go see the doctor. So I'm thankful for it. Don't think I'm not. However, I worked all my life for it too. And I just feel like we get more tests nowadays, and more blood tests, more urine tests, more drug tests, more whatever. And the only one making a living is the doctors and the nurses, and sometimes, And I also, before I go, don't like the idea. I've been here a year. Now this is everywhere, not just here in Texas. I've been here a year. I've never met my doctor. Never met my doctor. I have a nurse practitioner. And that's what they're doing now. but yet you're still paying for seeing your doctor or something like that. But anyway, y'all let me know how you feel about it, and if you know people who are choosing between their medication or test and putting food on the table. I love you guys. I'll try to get you another video as soon as possible. Thank you. Bye.